This is a Tallahassee update from the Florida Healthcare Association.
Hi, I'm Emmett Reed, Executive Director of the Florida Healthcare Association. Welcome to another edition of FHCA's Provider Program. We're just 2 weeks away from the end of the 2012 legislative session, and the budget conference is set to begin. Both chambers will now come together to work out differences in their respective budgets. While the Senate's budget has kept nursing home funding whole, recall the House cuts Medicaid funding for nursing home care by 2.5%. The timing was perfect for more than 200 FHCA members to be with us this week for another successful Lobby Wednesday.
Thank you. No more cuts.
Frontline caregivers were here with residents, meeting with their legislators to talk about how previous funding cuts, both to Medicaid and Medicare, have had an impact.
I am Jennifer Gilchrist, and I'm the Activity Director at Bayside Manor, which is in Pensacola, Florida. And I'm here at the Capitol to talk to my representative and my senator about the importance of protecting our funding for Medicare and Medicaid. This year has been a very hard year because of the budget cuts. I have lost one assistant in my personal department this last year because of the cuts, and we've had to scale back a lot of our activities that we used to provide in our nursing home.
And right here, she needs that. She needs care. She needs lots of care. She needs this bill. She needs help now. She can't. She's no longer, this part of her life is over. And this is where she is now. She's a resident in our facility.
Among those in town this week were members from Airamid Health Management, Opis Management Resources, Florida Healthcare Activity Coordinators Association, the Association of Nutrition and Food Service Professionals, and FHCA Districts 3, 4, 5, 8, and 13.
We're here with Opis Management Resources, long-term care, bringing our causes to the forefront.
It was great to hear from many of our volunteer leaders and other long-term care professionals about what keeps them coming back to Lobby Wednesday year after year.
My name is Robert Dixon. I'm with Healthcare Services Group. We're an environmental management company for dietary, nutritional services, housekeeping, and laundry. What we're up here to do this week is basically get in front of different state representatives to try to sway their votes and stop them from making changes and cuts to our local healthcare industries. Simply because we have to take care of the elderly, and we need to make sure that the elderly is taken care of by keeping things the way they are.
Hi, I'm Anita Fallman. I'm actually the Region 3 Vice President for Florida Healthcare Association, and I'm the Administrator at Orchard Ridge Care and Rehabilitation in Newport Richey, Florida. I'm here with the group from District 4 and District 5 representing Lobby Wednesday. So I can honestly say, as a member of this association, as a member of the district, as a support to all of the Lobby Wednesday efforts, that I'm happy to be here and I'm happy to be able to provide that voice, and I'm happy to be able to serve the message and be able to serve the elderly and the community of our association.
We're so excited to be here in Tallahassee. We just arrived, District 4 and District 5. I'm hoping to, yay! We're hoping to meet with some of our representatives and make a difference today with the rest of the groups that are here. So very excited, and hopefully we'll get some things done.
On Thursday, House Bill 621 by Representative Jim Frisch, the Nursing Home Quality Efficiency Act, which puts patients ahead of paperwork by eliminating some duplicative requirements, passed through the House of Representatives.
This is the nursing home bill we discussed yesterday, which will allow us to spend more time with the residents and less time doing paperwork.
House Bill 943 by Representative Doug Holder, which makes several fixes to the background screening law enacted in 2010, also passed out of the House. These bills were an important part of FHCA's legislative agenda, and we're pleased to see them advanced. We're watching both Senate companion bills as they make their way through their final committee stops, and will continue to keep you informed of their progress. In the meantime, we want to thank our members who have played an important role in educating lawmakers as to how these bills would help your staff and their delivery of resident care.
It is very nice when we have constituents from the district, particularly Pinellas County, who come up and visit the Capitol. As a representative for District 55, we like to show them around and give them a taste for what we do up here on the Hill.
It's great that the Florida Healthcare Association folks are up here, especially from our home district where we get to see the folks, and there'll be a day when I'm going to probably be there in the healthcare facility that they have. But it was really a pleasure to see them, and we got to talk a little bit about history and the process up here and how to make things happen.
As the budget is finalized, FHCA will continue working on your behalf to urge lawmakers from both the House and Senate to either move to or maintain the zero-cut position when all is said and done. You can stay up to date on the budget and the other bills we're tracking on our Capital Connection legislative blog found under the advocacy link of FHCA's website. Until next time, I'm Emmett Reed, keeping you informed about the critical issues that impact long-term care and the providers we represent.
And we're excited to meet with our representatives and our senators. We have meetings which we're on our way to, so wish us luck.